Here is your stem. Okay, so if you've read and understood, considering it critical care scenario, please tell me, how would you manage this patient now?
Yes, I will, this is critical, considering it critical care scenario, I will manage the patient according to ABCD approach.
Yes,
I will rapidly check patient's airway, and if patient can talk, I will
the
assume
patient
patient's
cannot
airway
talk,
clear. Um, Okay,
non-responsive.
I will do the maneuvers to keep patient's airway patent,
Okay.
and after taking breathing, I will give supplemental oxygen after checking patient saturation, and after checking patient circulation, um, after checking patient
Okay,
circulation.
first, okay, you've made sure patient's airway is patent. And
Yeah.
then second is breathing. Okay, patient was
Yes.
breathing merely. Then you'll go to circulation. Okay, what would you do with the circulation?
With the circulation, if patient is, I will check patient's blood pressure. If patient is in shock, I will start crystalline fluid, but I will
If
carefully
no,
monitor.
patient is in shock, patient is in grade 4, how would you manage this now?
I will start crystalline fluid for
Okay.
resuscitation. I will carefully monitor resuscitation as patient is an aged patient, and I will do cardiac monitoring as well as patient is having hyperkalemia according to the scenario, and then I will check patient's consciousness level. I will expose the patient under appropriate environment, and I will check patient's temperature as well. And after doing that, I've within the by side of this, I will send patient sample for baseline investigations, and I will do patients
Okay.
ECG as well. And
Right. What
yeah,
is the optimal way of checking body temperature?
Optimal way, non-invasive ways are I will check patient's axilla or tympanic membrane, or I can check rectal temperature as well. And there are invasive options as well, like esophageal probe or pulmonary artery catheter.
Okay. Oral is also non-invasive that you forgot.
Mhm.
If you call this patient suffering from hypothermia, what is the ideal temperature in your mind? And how would you classify it to be hypothermia? What should be the normal body temperature?
Body
What
core
is
temperature less than 35 degrees centigrade is
okay?
considered as hypothermic.
Okay. Is there any other classification by which you can classify hypothermia? Like mild, moderate, and severe? What is severe hypothermia
Uh, Less than
or critical?
no, ma'am. Sorry.
Less than 30. Okay.
Less than 34.
Two, maybe. All right. Okay. If you fail to manage this patient on time, what are the complications that can result?
It can affect patient's multiple system, like cardiovascular system. It will cause a decreased cardiac contractility, and it may cause arrhythmia, myocardial infarction, and ECG changes. And in case of respiratory system, it may affect patients. It will decrease patient's respiratory drive or effort. It will cause increased pulmonary vascular resistance and impaired VQ ratio. And in case of renal system, it will decrease the renal blood flow and glomerular filtration rate. It may cause cold diuresis. In case of gastrointestinal system, it may cause decrease gut motility, and neurovascular system, it may decrease cerebral blood flow, and hematological system, it may decrease the platelet function and clotting factor.
Coagulation. Okay, thank you.
Coagulation,
Please tell me,
coagulation.
how can you make sure to reduce the risks of hypothermia in general, not in particular for this patient?
Okay, in general, I can reduce in case of surgery.
Yes, as a surgeon.
Yeah, there are some nice guidelines. There are some preoperative measures like decrease the period of fasting, reduce and ensure patient's core temperature is above 36 degrees centigrade before induction of anesthesia. And in perioperative measures, like I will ensure the operative theater temperature 21 degrees centigrade, and I will ensure warm fluid, IV fluid as well as irrigation fluid, and I will in post-operative period, I will check patients. I will ensure patients' core body temperature 36 degrees centigrade before leaving the theater. These are the measures.
Yes, and maybe using the forced air warming devices, etc.
Yeah.
Okay, what are the factors or the
system.
mechanisms by which one can prevent him or herself from cold or from low body temperature?
I'm sorry, ma'am. Please repeat the question.
Yes, I'm asking, what are the mechanisms or what are the factors with which you can prevent oneself from being too cold?
Okay. Heat loss is generally by 4 ways.
Okay.
By evaporation from body surface and body cavities,
Right.
by conduction
Yes.
with the surrounding in case of operative patients, conduction of temperature to the OT table as well as surrounding cold objects, and convection to the surrounding cold air, and radiation to the surrounding cold objects.
All right. So what are the
Yes, by
factors?
preventing these mechanisms, I can prevent hypothermia.
Okay. Right. If you can tell me why radiation is considered as 50% responsible for the prevention of hypothermia. This factor.
Because radiation to other cold objects in the theater, it will cause in most of the case it will affect patients' multiple system. That's why I have to prevent this.
Okay. So if you could tell me, what is the last resort that you will try if to revive the patient or warm the patient? How far would you go with your management?
Different types of blankets or warming device I can use.
All you've tried, everything, then at the end? What is extracorporeal?
Extracorporeal, yeah, ECMO, membrane oxygenation. Extracorporeal membrane oxygenation.
Okay. What is it? That is the last resort you'll try. If it doesn't work, then okay, fine. Then you'll declare the patient dead. Okay, thank you.